Hey, what's up, everyone? In my office, as you can see, I just got another piece of paper. So I took the time. Let's see if you can read that. Lymphatic system and massage. So the lymphatic drainage thing. In the past few months, several people have asked me if I'm certified or if I do lymphatic drainage. And I told them no, because I wasn't certified in the specific techniques or had more knowledge of the particulars of what lymphatic drainage entailed, other than reducing swelling and reducing pain and increasing range of motion, which obviously, come to find out, is part of the certification and training. So let's take you down a historical road here. And well, with my spinal injured clients, so from 2008, we've always witnessed the lymphedema occurring, and we've always either referred them out to a lymphedema specialist to get that manual therapy for it. But I didn't start doing nothing for someone 2008, but maybe in 2012, we started using some of the other techniques that we knew of, and as exercise specialists for the spinal injured. But that wasn't the ultimate fix. So come 2015, had a client who had lymph nodes removed from her inguinal region, and it would cause her inner thighs to swell so bad that it prevented her from walking, among other things. So I gave it. She asked me if I knew of anything that could help. I'm like, well, not certified in that massage, and I'm definitely not going to be massaging that area of you. So let's try using my genie massager. And before the lymph certified individuals go crazy and chop my head off for doing that, it reduced the swelling. So my genie massager, the mechanical massager, that is the basically human car buffer. This big guy, okay, you see that? This thing is big, right? I use this on her inner thighs, and it reduced the swelling. She bought one. It reduced the swelling, gave her a feel-good sensation. Hey, she bought a genie massager, and she's still off to the winds with it. That was 2015. So 2016, I started massage school, part-time program, Atlanta School of Massage, graduated 2017. Got a lady, became certified in my Avazzia, and this is where it's relevant. And the Avazzia is microcurrent. It has different algorithms, different programs at different frequencies. So a person who then had a swollen knee joint, I was able to do up the lymphatic channel, light gentle strokes using the microcurrent to help facilitate fluid movement, and that worked. Then I did it on post-knee surgery. So one lady came to me, she had already had one knee done, she was going to get the other one done. So I've helped reduce the swelling and increase range of motion and mobility on the one surgery already done. And then the one that was going to get done, I helped prepare that one for the surgery. So that worked. Then I was able to work on her some more after she had the other surgery done. Again, using my Avazzia microcurrent device, reduced the swelling, increased range of motion, reduced pain, promoted cellular activity with my microcurrent Avazzia. Then, who came next? Trying to think. We can fast forward till now. During the COVID days, okay, during this time of COVID, I had a young lady, teenager, with swelling lymph nodes that her doctor said, your lymph nodes in your neck are swelling, through here on both sides. Don't worry about it. We'll watch it. That's what he told her. I'm not against the doctors. I'm not attacking the establishment. So guess what happened? I, with the Avazzia again, Y-bar, painted. So Y-bar, yeah, painted on her neck down the lymphatic route because it's draining downward now. We're going down towards the heart. Remember, lymphatic vessels go toward the heart. So I went down towards the heart using a microcurrent, or I stood still on the actual lymph nodes itself, reduced the swelling, took it down by more than 40-50%, and it kept swelling. Guess what? She had COVID. Okay, let's talk about that real quick. She had COVID. They found it after the fact. They realized that's why her lymph nodes were swelling. Hello, I was treating her in here while she actively had COVID. None of us knew. I used my oxygen, my Valkeon singlet oxygen device, and my pulse magnetic field therapy device, and this stimulated her vagus nerve and downward stroked the lymphatic vessels. And she would go on to run a personal best after COVID cleared her system. She went on and ran a personal best 5K in 17 minutes and something like 10 seconds. Less than 18 minutes, basically. Something about my therapies are working. You don't have to believe the science, the testimonials there. And it's her saying it, not just me. Then, at the same time, or different person, same like time frame, another woman coming, lymph nodes are swelling. Still can't figure out why. I say, hey, look, this other person had some damn swelling for an infection. You might want to then go and keep pegging your doctor to get this thing worked out. So again, Y-bar, Avazzia, painted downward strokes, or stood still, DZ0'd the tissue, reduced the swelling, and decreased pain, increased range of motion. She's experiencing, mild discomfort, but whatever I'm doing is helping. Again, it's helping. I'm helping facilitate things. I'm not treating. I'm helping facilitate things. So, another client, rheumatoid arthritis, a couple of them actually, and some osteoarthritis, swelling in the joints, limited range of motion, pain, limited mobility, at risk of falling. The list goes on. I took the conductive glove, which is one of these conductive gloves right here. This connects to the Avazzia device, and anchored an electrode on a person, took the glove on my hand, stroked upwards gently, used the motions to, now again, I hadn't done that certification yet. This is the point. I hadn't done a certification yet, but I'm doing it because when I see swelling, I know how to react. So I started doing the activity, and it reduced the swelling, reduced the pain, increased the range of motion, let the muscle function better. What the hell is Tony going? Doesn't matter if you're spinal injured, doesn't matter if you're stroke survivor, doesn't matter what you have in your body. Nothing short of Ebola. I think genuinely, I'll honestly say, E. coli don't scare me. But sure, it'll screw you up. It takes lives too. Ebola takes lives. Nah, that's kind of genuine. I ain't nothing I could do for Ebola. But this corona, shit. That's a weak virus. I know people have lost their lives, but I'm here to help. I'm not putting it down. I'm not saying nothing. I'm here to help, and my therapies are helping people who are coming and are submitting to the therapies. So take it or leave it. It is what it is, and I got the testimonials to back it up. So with the science to stand beside it, boom, on paper, not by me. So today I went ahead. Actually, like a couple weeks ago, I signed up for the lymphatic certification, CEU. Looks like we massage therapists have to do 48 CEUs this year or the next 2 years because of the hands-on clinics have been put on hold for a moment. So we're going to be responsible for 48. So if you're a massage therapist and you're watching this, today is December 21st, 2020. So come 22, don't scream, kick and scream that you see that the thing is doubled. See that the requirements doubled from 24 to 48. Or at least AMTA people got up for 48. So we'll see. But either way, I do it just because I do that much anyway. So I didn't know it's nothing to do with the requirement, the state requirement. I do that anyway. So I got this piece of paper, another cert behind my name. Now, it could say it's official. I can hang it up on the wall here. If you look around, there's enough hanging. Okay. Not all of them are hung. All the ones I have aren't hung. So it's just the ones that if a code enforcer walked in here, I'd have, hey, it's right there. That's what I'm doing. That's what that paper says I can do. So, so I got lymphatic drainage. I'm going to turn to and go back. I'm doing master acupuncture therapist, acupressure therapist, and of course my doctorate. So I'm going to turn to, and I still got to finish functional neurology. So I think I'm going to take out and hit another quiz on functional neurology side, functional neuroscience. So I got master acupuncture, acupressure, functional neurology, and my doctorate courses to finish. So I'm staying busy. I think that's everything. So if you have any questions, or if somebody needs it and they could benefit from it, lymphatic drainage is now officially on paper under my name. So thank you for tuning in. And if you have any questions, feel free to write in the comments below or shoot me an email at kinetictouchmedicalmassage@gmail.com. Or you can text me 404-966-6400. Again, 404-966-6400.